Karpan Pillay is going blind. His eyes have grown cataracts, bringing with them a creeping darkness and a terrible despair.
Can't even read the name of the horse. I felt like I lost my hope. I lost hope in everything. I thought I just lost my life. That's what I thought.
But tomorrow, there'll be every reason to live, thanks to a remarkable cure. This is Umpumulo District Hospital in KwaZulu-Natal. It's one of the few rural hospitals with a fully equipped eye clinic. In a country where thousands are losing their eyesight due to cataracts, all it takes is a simple operation for the blind to be able to see.
Isiningi manje manje sengiphatheka manje manje sengingena kuleliso ngapha
bese nginenkinga kakhulu ngoba bengike ngithi mangithi ngiyahamba mhlambe indawo kube sangazathi iphakeme mina mangithi ngiyabuka kanti ayiphakeme kwesinye isikhathi mangithi ngiyakhuphuka emastepesini kuvele kube mnyama emehlweni ngivele ngiwe.
If you lose eyes, hey, I don't think it's worth living. That's what I think. Truth, God, in my life, I'll take my gun and shoot myself. This will be an oath.
Cataracts are a condition where the lens inside one or both eyes grows gradually cloudy. As it progresses, vision becomes dimmer and more blurred until it becomes impossible to see anything at all. In South Africa, the damaging effects of ultraviolet rays from the sun mean that people who spend long hours outdoors without any protection face a higher risk of cataracts. But, unlike other eye diseases, it can be easily cured through surgery.
Kuyisimo esimbi nesibucayi ngoba abantu abadala kubanikeza ubunzima emakhaya kangangokuba kuze kudingeke ukuthi kuqashwe abantu abazobabheka ekhaya noma beyolanda imali yabo yesibonelelo sikahulumeni kudinga umuntu ozobaphelezela noma beyolanda imithi yabo yezifo abanazo njenganoshukela nomfutho ophezulu wenhliziyo bayadinga umuntu ozobaphelezela ngisho ukwenza umsebenzi wasekhaya ukupheka abakwazi kuze kudingeke ukuthi kuqashwe umuntu ozobabhekelela ngakho nje kubanikeza inkinga enkulu.
Cataracts affects nearly 1 million people and 80% live in rural areas where the consequences can be devastating.
Azizwa nomzimba ungasaphili nomzimba wami awusaphili angade ngithunga idwaba ngilokhuza ngeluka amacansi manje angisakwazi.
Cataracts are the leading cause of blindness in South Africa. In some cases, it's the result of poor diet, alcohol abuse and diabetes. But it's most common in the elderly, affecting 2 out of every 3 people by the age of 65.
Ngesikhathi mangibabuza ukuthi bazizwa benjani ngesikhathi bengaboni baye bangichazeleke ukuthi bazizwa sengazi ukuthi balahlekelwe ubuyena bonke umuntu aphelelwe yithemba abe nokwesaba ngisho endaweni akade yazi kade sabona asabe aphinda angathembi ngisho umuntu azizwe sengathi uhlele ehlathini ngoba kusuke kumnyama ngalolu hlobo lokuthi ngisho isandla sakhe akakwazi ukusibona kuba mnyama yonke into.
With a desperate lack of specialized eye nurses in rural areas to screen and diagnose cataract patients, many are unaware or suspicious of the treatment that's available.
Abantu abaningi baye basabe ukuthi cha uma beyokwengulwa bazoshona. Abanye banezinkolelo zabo ukuthi bafuzile. Ufuza umkhulu wakhe nomkhulu wakhe washona engasaboni okusho ukuthi naye ulandela kumkhulu wakhe. Kuyinkolelo zabo ke lokho okumele sizihloniphe. Sihlala phansi sibancenge sibachazele. Sithathe nabanye ukuthi nangu wengula wabona.
Although cataract surgery is a national priority, few public hospitals have the staff or capacity to cope. So a team of specialists from the United States and India are training local doctors to perform the operation.
We lack the eye care personnel to appropriately screen, counsel and refer people. Many of the primary healthcare nurses are doing their best, but often we need more people to support that. Most of these rural outlying hospitals don't have the surgical facilities or the ophthalmologists to be providing the service. The number of ophthalmologists in our public sector is too little to have that kind of outreach that we need within the public sector. Even if you start services in certain hospitals, if the budgets run low, then consumables becomes a challenge.
The cataract is removed under a local anesthetic and replaced with a clear artificial lens. It's over in less than 30 minutes.
Once they come to our table, operation table, we make some painting and wrapping that to make this area to be sterile. And then we start the surgical steps. In surgical steps, we put incision, and that incision is very say 2.8 to 3 millimeter size. So it is very minimum size of incision. We remove that cataract lens, and after removing that, we put the artificial lens. And the beauty of surgery, from the second day, the patient can do his normal work from very second day.
Cataract removal is one of the most cost-effective and successful healthcare interventions in the world. But around 350,000 South Africans in need of this surgery are on a waiting list, sometimes for years.
We have such a big backlog. And unless we get rid of the backlog, we're always going to be swimming against the tide. This is a beatable problem. We can win this battle. There are many conditions that are chronic. They go on and on. Your management has to be there for many, many years. You've got to constantly give people drugs. Cataracts, you do a surgery. After 2 hours, the patient is ready. You've addressed the problem. And I think it's something that it'll be good for our healthcare system in South Africa to have a significant victory. And if there's anything that we can eventually gain a victory through, is the management of cataracts in the public sector.
The dawn of a new day and the promise of a new life. For John Mdletshe, it's been a 3-year struggle to regain his sight.
Ngabona isikhathi sengibuyile lapha ekhaya. Hayi ngabona manje angisaboni kahle manje emahlweni. Ngisaboni ngathi ngisebenza impela. Konke bepalitho. Ngisebenza epalitho ngakho izindlu zabelungu ama flat also shifil. The post station imina ngiyaka futhi esandla zami lesi. Ngumuntu omnyama. UNkulunkulu ngiphile ngisinkwa. Ngustart 2 esikolweni. Angifundanga kakhulu. Kodwa ingqondo ikhona. Ngade nginalo impela ithemba hayi ukuthi ade nganali. Abaningi abantu abazi into leyo. Bazi ukuthi hayi lapha esibhedlela ngeke usabona. Ngani manje uzoqhumukisa wabheka nje yaqhumiso lakho.
Being poor and blind in a rural area makes treatment difficult. Hospitals are few and far between, and the cost of transport is higher than most can afford. So eye care is often low on people's list of priorities.
Kunzima kakhulu kumina ukwenza lo msebenzi ngoba kwesinye isikhathi ngishodela indlela yokuthi ngifika kanjani kubona. ngize ngizimpintshe ezimotweni zomahamba nendlwana ukuze ngifinyelele lapho ngizoye khona ukuthi kunabantu abanenkinga yokubona. Noma sengifikile kubona abanye kunzima kakhulu ukuthi ngibazuze.
It's the moment they've all been waiting for. Now they'll find out whether their surgery worked. Removing their eye patches brings startling results.
Right, Sengiyabona.
Ngijabula kakhulu manje ngibuka kahle yonke into manje. uNkulunkulu anibusise. Awu ngikhululeke kakhulu. Kakhulu kabi.
The procedure has few complications and 90% of patients will have their vision fully restored. But swamped by other pressing demands, rural hospitals seldom have the staff or resources to offer even basic eye care, let alone surgery. In remote communities, many people with cataracts simply never get treated at all.
Ngiyabonga Nkosi, ngiyabonga. Hawo. Sengiyakwazi ukuba ngisho udokotela emehlweni mangasaboni lutho. Yey. Hope ngiyababona manje bonke manje ngiyababona bonke.
The procedure costs less than 2,000 rand and can change a person's life forever.
It's fantastic, I'm telling you. And you're looking so beautiful. Thank you very much, Doc. I can see very, very bright. Not true. Bright.
It's right, it's clear. Thank you. Hey, with the paper I can't see yesterday, but now I can see clear. Hey, my God. Really, uncle?
To help take pressure off the overburdened health system, private medical providers, together with volunteer doctors, have joined government efforts by sharing the cost.
There have been a range of partners who've gotten involved to enable the cataract surgery to take place. So I think just underpinning what we do, it's really about giving people access to health care. It shouldn't be the preserve of those who can afford private medical aid, and secondly, to strengthen the public healthcare system. And we do this in a range of ways, because we've enabled doctors to be trained, and we've made an investment into the delivery of a service.
Outreach programs like this are treating an extra 4,000 patients over a 2-year period. They also give staff skills and experience to run an eye unit.
It's not a once-off investment that we've made, that what exists here now can continue, that people can access this facility because you've got medical personnel who are specialized in a particular type of treatment, and there's a huge understanding of what is required going forward. So I think that it's a sustainable project, and I think we want to ensure that people will always be able to access a facility of the kind like this one here.
For these patients, the program has brought them a future full of possibility.
Ngathi ngiphuma kwenye nje indawo engingayazi ngathi sengibuyele kwelinye izwe nje namhlanje sengijabule kakhulu ave sengikhululekile.
Within hours of having her dressing removed, Thandi Umpumulo is back home.
Uyangibona mina ngiyakubona ngempela into epink idol pink iskipa pink imbali la amaflower sengibona njengoba ngiwabona vema yabonga wema awukwahleke ngibona step la ngeke nje sangiwisa ngeke sakuwisa woza ke ngibona ngithi kumpula ngithi lema step isayangwisa ngoba ngiboni woza ha awubheke nje siyabonga unjani gogo. Ngiluza impilo yami yonke ngoba phela ayikho into engabuya ngiyenze uma amehlo ngingenawo. Into ebalekile ukuthi amehlo ube yiwona akwazi ukubona ukuze ngikwazi ukwenza yonke into ngoba ngaphandle kwamehlo ayikho into ongayenza. Futhi mangiluza amehlo phela ngiluza impilo yami yonke ngoba impilo isemehlweni.
As so often in rural areas, her husband is away, working in Durban, so she'd been left to run the house and look after the family alone. With no help at all, not even services like water or electricity, her blindness made an already heavy workload even more difficult to cope.
Kwabe ngikuthanda ukusizakala ukuthi amehla avuleke. Nakho kasevulekile futhi. Ungasabi kwami kungisizile mina. Ngoba amehla avulekile. Ukuba ngisabile ngabe namanje ngisahamba ngiphumputha. Kodwa ngoba ngikwazile ukuhamba amehla avulekile.
The freedom to move without fear of falling over is such a huge breakthrough that the first thing she does is head off to her fields.
Ya bekunzima kakhulu ukusebenza ensimini nokuhlakula obhontshisi kanjena. Ngoba kuqala kade ngithi ngisashaya uvela ugenqeka ubhontshisi ngawuboni. Ngizizwa ngijabule kakhulu. Ngijabulele konke ngikubonile bengikushela ekhaya imbuzi zami sengiyibonile inkukhu namasemami. Awu kade sengiyoshaya ngahlakuhlakula nobhontshisi wami njalo sengijabulile. Inhliziyo yami ithe
For the first time in 4 years, Albert Mtetwa can see his children and grandchildren. It has given him a new lease on life and is cause for much celebration.
Bumnandi. Awu bumnandi. Nelanga libalele bumnandi. Okay. Beke phansi ke. Kodwa phansi. Ophinda. Bumnandi. Singamnika omunye umuntu. Kungambiza. Hus. Shalo. Hus. Sha. Hus emkhulu. Hus. Bumnandi. Shaya lokulu.
Ebezinzima izinto bengakwazi ukukhipha inkomo izingane sesikoleni ngihlupheka inkomo ivele ngishiye ngelikulu ijubane ibaleke ngoba ongathi yazi ukuthi angisabone emehlweni.
It's not just the blind who suffer. The loss of income can send whole families spiraling into a downward cycle of poverty and despair.
Cataracts constitutes 50% of avoidable blindness. And there's enough studies that have been shown that close to about $250 billion of lost productivity occurs as a result of blindness. And we can tackle 50% of this problem. It's also about quality of life. I mean, many of the people who are affected by cataracts, because it's an age-related condition, are people who have worked all their lives and have struggled all their lives to educate and support the younger generation. And at the time of their life when they should be relaxing and enjoying themselves, they are now confronted with this blindness.
For Albert Mtetwa, being forced to depend on other people was the worst part of blindness. He'd felt robbed of his purpose and also his dignity.
bona yonke into nokucenta egcekeni ngibona ukuthi awungcolile la ngithatha igeja ngicenta egcekeni mase ngikhathele ngibuye ngihlale kancane ngiphumule.
Curing blindness is more than treating a handicap. It's a release from years of inactivity and confinement.
Bengihlupheka kakhulu kabi. Ngithi ngiyafuna ukuzenzela ngithume umuntu kanti naye ayazi ukuthi ngiyibekephi ngihlupheke ngize ngimkhombise ukuthi hawu ngiyibeke lapha ngingasaboni sele kubamba amehlo.
The onset of blindness is one of the most challenging hardships that a person can live through.
Kodwa ngiyabonga namhlanje lapha kamaphumulo ngingisize kakhulu inhliziyo yami ngabe ngiyahamba emhlabeni kodwa imposisi.
John Mdletshe was building his family home when he went blind. It put an end to all his plans as well as the construction.
Ngajabula impela kakhulu. Bebethe embuzo umama hawu usakaza ukubona ukuthi hayi singayazi sembuka phezulu ngivaleni iliso hawu ngibona semboya ilufu oh ime kanje straight manje ngaze tafana njengokuqala manje ngabona ngisize kakhulu ngiyabona hayi umsebenzi ngisazowenza ngibona manje ngiyawuthanda umsebenzi angihlali phansi mina umuntu osebenzayo too much.
Leaving the house incomplete had been a source of pain and frustration, so within a day of his surgery he's already started adding on an extra room.
Ngiyabule kakhulu ngibona sengibuka kahle manje ngathi ngiyaqala ngifike emhlabeni namhlanje.